Most people don't realize how hard their kidneys are working until they start to struggle. These two small organs quietly filter your blood more than 100 times a day, removing waste, balancing fluids, and helping control blood pressure, all without asking for attention. You don't feel them working, you don't hear warnings. And that silence is exactly why kidney problems often go unnoticed for years. For many people, the first sign is a routine test that doesn't look right. Creatinine is slightly higher, filtration is slightly lower. The doctor says, let's keep an eye on it. At that stage, dialysis may sound far away, but the worry has already begun. People start asking themselves how they got here and what they can do to slow things down. What often gets overlooked is that kidney decline is rarely sudden. It's usually the result of long-term strain, inflammation, oxidative stress, high blood pressure, blood sugar swings, dehydration, and everyday exposure to stressors slowly wear the kidneys down. And while medications and medical care are essential, daily supportive habits can also influence how much pressure the kidneys are under. For generations, traditional health systems around the world paid close attention to plants and leaves that supported the body's natural cleansing processes. These leaves weren't used as cures or replacements for doctors. They were used as gentle, consistent supports, especially for the organs responsible for filtration and balance. Today, researchers are beginning to study why some of these leaves were so widely valued. Certain natural leaves appear to support kidney health by helping the body manage inflammation, supporting circulation, and assisting with fluid balance. When used responsibly, they may help reduce some of the everyday stress kidneys face. This doesn't mean they prevent disease or eliminate the need for medical treatment, but they may help create conditions where the kidneys can function with less strain. This matters most in the early and middle stages of kidney stress, when function is still present and protection can make a difference. Waiting until symptoms are severe often means waiting too long. Supporting kidney health earlier is about preservation, not reverse. This video is not about guarantees or miracle claims. It's about understanding how certain natural leaves have been traditionally used, what modern research is exploring, and how they may fit safely alongside medical guidance. If protecting your kidneys is important to you, or if you want to understand how small daily choices can support long-term kidney health, stay with me. The information ahead may help you think about kidney care in a more informed and proactive way. One of the first things to understand about kidney health is how sensitive these organs are to daily stress and exposure. Kidneys are constantly filtering the blood, removing waste products, balancing minerals, and managing fluid levels. Because of this nonstop workload, kidney tissue is especially vulnerable to inflammation and oxidative stress, two processes that quietly damage delicate filtering structures over time. When this damage accumulates, kidney function can gradually decline long before any symptoms are felt. Traditional use of certain natural leaves has long focused on easing this burden rather than forcing the kidneys to work harder. Many of these leaves were valued because they appeared to support gentle cleansing and balance without overstimulating the system. Modern research has begun examining this idea more closely, particularly how plant compounds interact with inflammation and cellular stress inside the kidneys. Some leaves contain naturally occurring antioxidants, which help neutralize free radicals produced during normal metabolism. Free radicals are unstable molecules that can damage kidney cells if they are not kept in check. When antioxidant support is low, oxidative stress increases, placing extra strain on the kidney's filtering units. Research suggests that antioxidant-rich plant compounds may help reduce this stress, creating a more supportive environment for kidney tissue to function properly. Another important factor is inflammation. Chronic low-grade inflammation is common in people with high blood pressure, diabetes, excess weight, or aging-related changes, all of which are major risk factors for kidney decline. Certain leaves traditionally used in teas or infusions have been studied for their anti-inflammatory properties. By helping calm inflammatory signaling, these compounds may reduce irritation within kidney tissue, allowing normal filtration processes to continue with less disruption. Fluid balance also plays a critical role. Kidneys regulate how much water the body retains or releases, and even mild dehydration can increase kidney strain. Some natural leaves have been traditionally used to support healthy fluid movement in the body. When used responsibly, they may encourage gentle balance rather than aggressive fluid loss, which is important because overstimulation can be harmful to kidney health. What makes this approach meaningful is its focus on support rather than intervention. Instead of trying to fix the kidneys, these leaves have been used to help reduce the everyday pressures that slowly wear kidney tissue down. This aligns with how kidney decline often develops, not as a sudden event, but as a gradual process influenced by long-term conditions inside the body. It is also important to understand that these supportive effects are most relevant when kidney function is still present. When severe damage has occurred, natural supports cannot replace medical treatment. However, during earlier stages or for people looking to protect kidney health proactively, reducing inflammation, oxidative stress, and fluid imbalance may help preserve function over time. For many individuals, this perspective shifts kidney care from fear to awareness. Instead of waiting for alarming test results, attention is placed on daily support and long-term preservation. Natural leaves are not magic solutions, but when used carefully and alongside medical guidance, they may contribute to an environment where the kidneys are under less strain and better able to carry out their essential work day after day as part of a broader approach to maintaining kidney health and reducing unnecessary stress on these vital organs over time. Another important aspect researchers and traditional practitioners point to is how consistency and gentle use matter far more than intensity when it comes to supporting kidney health. The kidneys are not designed to handle sudden extreme. Harsh detoxes, aggressive cleansing, or strong stimulants can actually increase strain rather than reduce it. In contrast, the leaves traditionally associated with kidney support were used in mild forms, often as teas or infusions taken regularly in small amounts. This matters because the kidneys respond best to stable internal conditions. Blood flow, pressure inside the filtering units, and electrolyte balance all depend on predictability. When the body is exposed to sharp swings, whether from dehydration, excessive fluid loss, or sudden chemical stress, the kidneys must work harder to restore balance. Gentle plant compounds, when used consistently, appear to support steadier conditions rather than forcing rapid change. Another factor is circulation. Healthy kidney function depends on good blood flow through very small vessels. High blood pressure, aging, and metabolic stress can narrow or stiffen these vessels over time. Some natural leaves have been studied for compounds that support vascular relaxation and healthy circulation. Improved circulation means kidney tissue receives oxygen and nutrients more efficiently, while waste products are removed with less resistance, reducing overall strain on the filtration system. Consistency also influences inflammation levels. Inflammation is not an on-off switch. It rises and falls depending on daily inputs such as diet, stress, hydration, and metabolic balance. When supportive compounds are introduced regularly, the body may maintain a calmer baseline rather than cycling between flare-ups and recovery. This calmer environment can be particularly important for the kidneys, which are sensitive to inflammatory damage over long periods. Researchers also note that kidney decline often accelerates when supportive habits are inconsistent. People may drink plenty of fluids one day and very little the next, or alternate between careful and careless eating. These fluctuations create repeated stress cycles. Gentle, regular support helps smooth out these variations, giving the kidneys a more predictable workload. It is also worth noting that many of these leaves were traditionally used alongside lifestyle habits such as adequate hydration, balanced meals, and rest. Their effects were never isolated. This reinforces the idea that natural supports work best as part of a broader pattern rather than as a single solution. When combined with medical guidance, blood pressure control, and blood sugar management, they may help reduce cumulative stress on the kidney. For individuals concerned about long-term kidney health, this approach emphasizes patience and steadiness. Instead of chasing dramatic changes, the focus shifts to daily practices that quietly support balance. Over time, reducing repeated stressors and supporting circulation, inflammation control, and fluid balance may help preserve kidney function and delay progression of decline by creating internal conditions that are less demanding on these vital filtering organs as the body continues adapting to ongoing demands without being pushed into extremes. Another layer researchers explore is how certain natural leaves may influence the body's internal filtration and detox pathways in a supportive, indirect way. The kidneys do not work in isolation. They are closely connected with the liver, digestive system, and circulatory system. When these systems are overloaded, the kidneys are forced to compensate, increasing their workload. Supporting overall detox balance can therefore reduce pressure on kidney function over time. Some plant leaves traditionally associated with kidney support contain compounds that appear to assist the body in processing waste more efficiently upstream before it reaches the kidneys. When metabolic byproducts are handled more smoothly by the liver and eliminated through digestion, the kidneys encounter fewer concentrated toxins to filter. This does not clean the kidneys directly, but it may lower the intensity of what they must handle daily. Another important aspect is mineral balance. Kidneys regulate sodium, potassium, and other electrolytes that influence blood pressure and fluid movement. Imbalances in these minerals can strain kidney tissue and accelerate decline. Certain leaves have been traditionally used in ways believed to support gentle mineral balance rather than depletion. This is especially important because aggressive diuretics or detox methods can disrupt electrolytes, creating additional risk for people with vulnerable kidney function. Researchers also note that oxidative stress inside kidney tissue is strongly linked to long-term damage. When filtering units are repeatedly exposed to oxidative byproducts, their structure can gradually weaken. Many natural leaves contain polyphenols and other plant compounds that have been studied for their antioxidant activity. By helping neutralize oxidative stress, these compounds may support the integrity of kidney cells over time. Another factor is how these leaves may influence blood pressure indirectly. High blood pressure is one of the leading contributors to kidney decline. Some plant compounds have been studied for their ability to support vascular relaxation and improve endothelial function. When blood vessels are more flexible, pressure inside the kidney's filtering units may be reduced, easing mechanical stress on delicate structures. What stands out in both traditional use and modern research is the emphasis on balance rather than force. The goal has never been to push the kidneys into higher output, but to reduce the conditions that make their job harder. This includes supporting smoother circulation, calmer inflammation, steadier mineral levels, and more efficient waste handling throughout the body. For individuals focused on kidney protection, this perspective reframes the role of natural leaves. They are not seen as cures or substitutes for medical treatment, but as part of a broader strategy aimed at reducing cumulative stress. When combined with hydration, blood pressure control, and medical supervision, these supportive actions may help preserve kidney function by making the internal environment less demanding, allowing the kidneys to continue filtering effectively without being constantly pushed to their limits as the body ages and adapts to long-term metabolic challenges. Another important dimension researchers consider is how these natural leaves may support kidney health by influencing insulin sensitivity and blood sugar stability, which are closely tied to kidney stress. Even mildly elevated blood sugar levels can place continuous pressure on the kidneys over time. Excess glucose in the blood forces the kidneys to filter more aggressively, increasing workload and accelerating wear on the tiny filtering units known as nephrons. This process often happens silently, especially in people who are not formally diagnosed with diabetes but still experience frequent blood sugar fluctuations. Some natural leaves traditionally used in daily teas have been studied for compounds that may help support more stable blood sugar responses. By assisting the body in processing glucose more efficiently, these leaves may help reduce repeated spikes that strain kidney filtration. This does not mean they treat diabetes or replace medical care, but they may contribute to a metabolic environment that is less demanding on the kidneys over the long term. Another related factor is insulin resistance, which becomes more common with age. When cells respond poorly to insulin, the body compensates by producing more, leading to higher circulating levels of insulin and glucose. This state promotes inflammation, fluid imbalance, and vascular stress, all of which negatively affect kidney tissue. Research suggests that plant compounds with anti-inflammatory and antioxidant properties may help moderate this process by reducing systemic stress signals that contribute to insulin resistance. Fluid regulation is also closely connected to blood sugar balance. High glucose levels can pull excess fluid into the urine, increasing dehydration risk. Dehydration forces the kidneys to concentrate waste more heavily, further increasing strain. Certain leaves have been traditionally consumed in ways that encourage gentle hydration and balance rather than aggressive fluid loss. This steady hydration pattern supports kidney filtration without forcing excessive concentration cycles. Researchers also point out that metabolic stress rarely affects the kidneys alone. It impacts blood vessels, nerves, and connective tissue throughout the body. When systemic stress is reduced, kidney tissue often benefits indirectly. Supporting overall metabolic stability may therefore be one of the most practical ways to protect kidney function over time. What makes this approach relevant is that many people focus solely on kidney-specific interventions while overlooking the broader metabolic environment. Addressing blood sugar variability, inflammation, and hydration together, supportive practices may reduce multiple stressors simultaneously. Natural leaves, when used responsibly and consistently, may play a role in this broader pattern by contributing plant compounds that support balance rather than force change. For individuals concerned about kidney health, this perspective highlights prevention rather than reaction. Instead of waiting for kidney numbers to worsen, attention is placed on daily metabolic conditions that quietly influence filtration workload. Over time, reducing repeated metabolic stress may help preserve kidney function and delay progression, allowing these vital organs to continue performing their essential role under calmer, more supportive conditions, as part of a long-term strategy focused on balance, consistency, and informed care rather than urgency or extreme. The final point researchers emphasize is the importance of realistic expectations and long-term protection when it comes to kidney health. Kidneys do not recover quickly, and meaningful preservation happens slowly through reduced strain rather than dramatic change. This is why natural leaves, when discussed responsibly, are viewed as supportive tools rather than corrective solutions. Their value lies in how they may help lower everyday pressure on kidney function over time. One reason this matters is that many people approach kidney health only after damage has progressed. At that stage, options become limited and fear takes over. Research and traditional practice both suggest that the greatest benefit of gentle supports comes earlier when kidney tissue is still functioning and capable of adaptation. Reducing cumulative stress before severe decline may help slow progression rather than reverse damage. Consistency is central to this idea. Sporadic use of supportive practices does little to change the internal environment. The kidneys respond to patterns, not isolated actions. When supportive compounds are introduced regularly in mild forms, the body adapts gradually. Inflammation may remain lower, circulation steadier, and fluid balance more predictable. These subtle changes can reduce the repeated microstress that contributes to long-term decline. Another important factor is safety. Aggressive approaches, often marketed as cleanses or flushes, can be dangerous for kidney health, especially for older adults or those with existing conditions. Research consistently warns against forcing the kidneys to work harder in the name of detoxification. Gentle food-based supports align more closely with how the kidneys are designed to function, emphasizing protection rather than stimulation. Researchers also highlight the psychological aspect of long-term care. Fear and urgency can lead people to make extreme choices that increase risk. A calm, informed approach encourages steadier habits and better adherence to medical guidance. When individuals feel empowered rather than frightened, they're more likely to maintain supportive routines that actually benefit kidney health. It is also important to recognize that kidney protection does not exist in isolation. Blood pressure control, blood sugar management, hydration, sleep, and medication adherence all remain foundational. Natural leaves, when used appropriately, are considered complementary, fitting into a broader framework of care rather than replacing it. For many people, the most meaningful outcome is not avoiding dialysis through promises, but extending kidney function through preservation. Research supports the idea that reducing repeated stressors, maintaining balance, and supporting the body gently can make a difference over time. This long view approach reframes kidney care as an ongoing process of protection rather than a race to fix damage, emphasizing patience, consistency, and informed choices that support kidney health quietly and sustainably as the body ages and adapts to changing demand. What this discussion ultimately highlights is that kidney health is shaped long before serious intervention is ever mentioned. These organs respond quietly to the conditions they live in every day, to inflammation levels, hydration, circulation, blood sugar stability, and the overall balance the body maintains over time. Protection is rarely about one dramatic action. It is about reducing strain consistently and thoughtfully. Natural leaves, when talked about responsibly, are not cures and not substitutes for medical care. Their their value lies in how they may support the body gently, helping create an internal environment that is less demanding on the kidneys. When combined with proper medical guidance, regular checkups, and management of underlying conditions, this kind of support fits into a broader strategy focused on preservation rather than panic. The most important takeaway is awareness and timing. Waiting until kidney function is severely compromised often limits options. Paying attention earlier, supporting balance, and avoiding extremes can make a meaningful difference in how long the kidneys are able to do their job effectively. Small, steady choices tend to matter more than aggressive interventions. Kidney care does not have to be driven by fear. It can be approached with calm, patience, and informed decisions that respect how the body works. When the focus shifts from quick fixes to long term protection, kidney health becomes something that can be supported quietly and consistently, allowing these vital organs to continue serving the body with less strain and more resilience over time as part of a thoughtful, sustainable approach to overall health.